New patient questions that realistically they should have an idea of before they come and see you guys, but you still get hit with a few questions that you're like, come on.
Is TRT a lifelong therapy? Now, the answer to that question is it should be considered a lifelong therapy because you shouldn't go on it unless you clinically need it. So that really means making sure that you've addressed other comorbidities like low thyroid, etc., your lifestyle, your nutrition, your exercise, your mindset. So yes, you should only go on TRT if you clinically need it, and you should consider it a lifelong therapy, but you can come off of therapy. Why would you come off of therapy? Well, because financial reasons, you don't get on with it for some reason. Essentially, if you come off therapy after about 5 years, you'll go back to how you would have been in 5 years' time. So our gold standard is testosterone and HCG, so you'll preserve testicular size and function, so it makes coming off easier. But even if you choose testosterone monotherapy, your body will recognize the fact you've got low testosterone, your hypothalamus will send the signals down to the pituitary and then down to the testicles. So yeah, it's just a matter of time. But yeah, only go on TRT if you clinically need it.
Do you find that some patients don't really understand the reason for that first new patient consultation and the importance of it? They just turn up a little bit, well, I was told to be here, I just need to be here. Do you find that that importance is a little bit lost?
Yeah, I think sometimes it's not a bad thing. Sometimes patients are there to discuss like what's involved with TRT and the possibility of it, and get a better sense of it before maybe necessarily concretely making a decision. So sometimes the assumption I make is that actually if patients are coming for a new patient consultation, they've made that decision to start treatment, which most of the time is true, but there are some patients who are still kind of on the fence and want to know a bit more. So yeah, maybe having a little bit of a read and research before. The website is really good, it's got loads of information on there, but then equally that new patient consultation is to explain exactly what's involved and how to proceed.
So obviously from an admin point of view, we can tell people about what to expect in regards to how the consultation will start and things like that. What actually happens during the consultation? Because obviously that's a mystery to us from this side of the desk, and obviously going to be a mystery to patients that are going to be coming in. So just a rough guideline of kind of what to expect.
Well, you're going to get Carl Jung quotes from me. Bit of Nietzsche, bit of Yin Yang, yeah. Alan Watts.
Yeah, you'll probably get some jiu-jitsu chat forced on you, whether you like it or not. I don't know, personally what I like to do is just get a sense of who that person is at baseline. So it helps me get a sense of how things are potentially going to go. So are they hitting the ground running? Are they doing the right things in terms of diet, exercise, sleep, stress reduction? Are there things that we can maybe suggest, let's get the ball rolling with these things already, because you're going to hopefully start feeling better, and that's the only way you're going to get benefit from treatment is by doing the right things. So a little bit of background there, and sort of what's the main motivator for them coming to the appointment. So what's the things that are important to them? Is it libido? It's often a combination of things, but getting a sense of that.
It's a chance for them to tell their story.
Yeah.
So they haven't been listened to when they've been to the GP. They've bottled all of this up for a long time. Hopefully it's a very considered decision when they come to a clinic. And they're faced with somebody that understands it, and they can have an opportunity to go, right, is this normal? And the answer to that question is, yeah, it's always normal. We've heard the story thousands of times. It's your subjective experience, but objectively, when you're sat there, we've heard it all before. So it provides that level of necessary reassurance that they haven't got from the internet with that plethora of information and their doctor that they've approached before. So I think that's an essential part of that kind of initial first person contact, is say, right, relax, you're okay.
Yeah, exactly. And then, we'll do a bit of housekeeping in terms of, medical history, medications you're taking, that sort of thing. Guys who are, over 40, particularly into their 50s, we're going to recommend that we do things like prostate check and testicular examination if you're coming into clinic, and or getting those done beforehand if you're seeing us remotely. And then we essentially run through the kind of reason we do or prefer to do daily injections, subcutaneous testosterone, cypionate and HCG. run through that, and then we'll run through the medication side of things, to how to prepare things, how to do your injections. Essentially, the whole appointment should be a big reassurance. That's what I aim for, is that you feel a bit more confident about what you're doing, what's involved, and that we're looking after you.
It's that amusing thing when you see their shoulders just relax when you give them that first injection.
Yeah.
And I make my terrible joke, it's just a little prick. But they laugh because it's corny, but it's like, right, okay, I've finally found hopefully my answer. And then again, you give them those realistic expectations to say, earn your reward. But this is the start, this is day one.
Yeah.
Do you find there's a difference? Obviously, there is clearly a difference between new patients that come on board that have never been on treatment and patients that are transferring their care over to us, in regards to a patient from a patient that's coming in from a transfer of care. Yes, they're not happy with their previous provider, but potentially this is just what sometimes we get on the phone as well. They tell us they still want to stick to the same protocol. So obviously, do you then have to nail in the fact that we know what we're doing? You've got to trust what we do and just follow the process.
Yeah, I mean, we know this to the nth degree. So we explain the basic fundamental principles of the HPG axis. We talk about side effects, complications, etc. And we describe to them in great detail why your previous protocol doesn't work and how it can't really work, and how we always want the best for our patients, and which is why we suggest what we suggest. Again, we've had a little bit of a shift from enforcing daily injections of TESTIP and HCG because it's the best way to do it, and it's the way that your body produces testosterone, LH, and FSH. But we can always act in your best interest. So I think as we say to all the patients online, trust the process. Again, it's been done thousands of times before, and we will always act in your best interest. So the guys that come from other practices, they're always in a state of desperation because they haven't got what they wanted. What do they want? Those big muscles and high libido that the other practice promised them. But it's just about normalization of your testosterone levels. And the issue really is about giving them the realistic expectations with the right time frame. And again, as we've said before, providing them with that level of reassurance that they need, that they are now being looked after by two doctors who understand this to the nth degree, and a clinical admin team that will again always give you the information that you need.
Do you find, obviously, the patients that get the best results are the ones that do just go with what the advice? Because there are some patients out there that like to push back.
ChatGPT is the bane of our life, because the reality is it's a very useful tool, but it's based on probability. So when we talk about microdosing testosterone replacement therapy, when we talk about testosterone replacement therapy, there's not enough data out there to be very confident in an AI tool at this moment. So yeah, it can be a challenge.
We assume, and I think rightly so, because we send everybody information and there's loads of information out there for them to access, that they are aware of the costs involved. We're a private clinic, there's a cost involved. That's how it goes. But I know from patients who come out of their new patient consultations, and I'm sure when you have chats with people in there, they still go with you when they come to start treatment. Oh, how much is this going to cost? I mean, I know the conversation we have this side. How do you handle it at your side?
So I always explain that the biggest initial cost is that first new patient consultation, because you've got the consultation, you leave with 4 months worth of medication. And then it go on to explain that obviously the first 6 months there is more cost involved because you've got more appointments and more blood tests, and that's part of that titration process to hopefully get you dialed into a protocol that works for you.
The price is appropriate to the level of care and support and value that you will receive, as long as you're aware of what you need to be doing. So there are different prices based on whether you're a new patient presenting for the first time, whether you're a transfer of care, whether you're online. So the price does vary now. Obviously, as we encourage everybody to do, show due diligence and ring you and have a chat to you about the appropriate pricing for you. Again, when people are surprised in the new patient consultation, I think that fundamentally boils down to a level of desperation and a level of, obviously, one of the symptoms of low testosterone, which is a bit of brain fog, because I'm 100% sure you've already spoken to them about costings. But when you've got brain fog and you're tired and you're feeling quite desperate, you're not critically thinking. And that is a big challenge for patients. And again, when you walk into that new patient consultation, it can be quite daunting. And again, I think, we do the videos, we're doing all this marketing, not to market the clinic as we want to provide that level of empathy so that people can walk in with that level of assurance that they need to go, right, okay, I'm in the right place. And I think that's the key.
I think you're right. I think it's the level of empathy and the fact that when they come into the clinic here, they are treated as an individual. Because the conversation that we have with them when they're on the phone is that, they all start out, or looked online, and there's multiple providers that will charge me £120 a month and they'll give me this and that. And it's a simple drawing the line. It's a case of you're treated as an individual, your pricing will be structured given your protocol and your care. It's a simple, you won't get signed up for a membership that you can't get out of for X, Y, Z. You pay as you go. You pay for it, you get it. And what you get is the value for money.
Yeah, I think one of the completely unethical aspects of online providers, TRT services, is once you've had a blood test with them, you're then bombarded with emails of weight loss drugs, of finasteride, and no ethical TRT service provider would be advising finasteride alongside testosterone or instead of. We have a very strong ethical principle and integrity that we don't change, and we'll stick to it.
So obviously, I know you touched at the start in regards to patients have always got the options to stop treatment. We always class it as a lifelong treatment, correctly so. But how would that process happen in regards to a patient changes their process, as in they don't want to continue? How would they stop treatment effectively?
There's a few avenues, and we give them the options. You can simply just stop and wait for your HPG axis to kick back in, and we advise patients to obviously concentrate on sleep, stress, nutrition, exercise, mindset, but understanding that over-exercising can further lower your testosterone when you're in a hypogonadal state. If you're on HCG, you can, alongside testosterone, you can stop the testosterone and continue the HCG for a bit, and then allow your body to recognize it's got low testosterone. One of the benefits of HCG is the fact, obviously, you're preserving testicular function. So, if you're on testosterone monotherapy, you're going to get testicular atrophy, and essentially your testicles aren't working. So that process takes a little bit longer, which is why, obviously, we like the idea of it to be HRT, not TRT. You could also go on a medically supervised restart protocol, which is a variation of Michael Scully's power PCT that the bodybuilders use. Now, we've learned an awful lot from the bodybuilders. The use of HCG came from bodybuilders wanting to preserve testicular function after a cycle. But we've taken that and we've made it professional, and we understand the science. So there is a concoction of drugs that you can use to sort of kickstart the process back into normal function, but it comes with pros and cons. But again, this is why we don't. Well, we insist on a conversation as opposed to, there you go, do what you want. Again, we're always acting in your best interests.
In regards to age groups, obviously we've got a wide spectrum, but I know a lot of people say, am I too young? Am I too old? What's your answer to that?
I think the answer is that there isn't a right age for TRT, but that's what's asked quite often. Am I too young? Am I too old for TRT? What it boils down to is, again, that individual care. It's that person as an individual. What are they doing in the background in terms of the lifestyle factors involved? What's the historic bloods look like? There's not a kind of age that's this, right, you have to be this age, or this age is too old to continue, or that sort of thing.
I think the interesting thing is we always have that comparison with female menopause, which is a defined period in a woman's lifeline where she stops menstruating and she stops releasing the egg from the ovaries. So I think that's where that's come from. I think disappointingly, we see men with testosterone deficiency younger and younger because we live in a poisonous world and in an estrogenic world. And I think epigenetics plays a massive part in that. So alarmingly, we have people who are 18 contact clinic, and we've recently had somebody who was 17, and we said that we couldn't help them because obviously you have to be an adult to be under our care and supervision, and they're counting down the weeks to turn 18 to be under our care and supervision, and they're already under an endocrinologist who, again, isn't advising them correctly. It's true, but it is what it is. So they're waiting till they're 18 years old. And again, the other end of the spectrum is we have 90-year-olds contact clinic, which is amazing because I think what do these 90-year-olds want to do? They want to. Well, we all know what they want to do. I'm not sure Ethel's going to be too happy, but they want to lead their best life, and it's like life isn't over. Life is about right now, and I think I'm always so excited when I get an email from somebody who's late 80s, 90s. It's like, God, fair play, fair play.
Yeah.
What's the kind of outlook for patients that are consistent on treatment, do follow the process, the lines, the bloods match where they need to be, the ongoing outlook, because it is lifelong therapy, as you say. So, how do those patients gonna look long term?
You go from my size to Sean's size. Yeah, I told you to move away.
I think it's just thriving, isn't it? So I can speak from personal experience. It's just it's the difference between going through the motions with everything you're doing, whether that is disciplined and doing the right things you should be doing, actually enjoying life and getting the most out of it. We're here once. It's why with the age thing, I think a lot of the guys in their sort of 30s, 40s, they're the ones who say, well, should I wait until X8? What's the point of waiting to some arbitrary age if clinically you are suitable for treatment? You live once, we're here once. So
yeah, I mean, it's about leading your best life, and it sounds terribly cliche to say that, but I mean, it's about appreciating the moment. It's about coping with life stresses. So when patients come back for their 12-monthly review, how's your year been? So it's been stressful. But you know what? I've coped better than I would have coped without TRT. And again, it's about building those little wins. It's about building momentum to be the best version of yourself. And that's the truth.
yeah.
So blood testing for new patients, obviously they've got clear path. So that path is set in regards to the consultations they need when they start treatment. So sometimes the pushback from that is, well, why do I need it? We know why you need it, but how would you explain that to a patient?
I think particularly in the early months, and to be honest, in the first year particularly, your physiology is changing along with treatment. So I think what patients sometimes don't understand is if you feel great and bloods look great, 10 weeks in, you're a bit of a moving target, particularly over that first year, because you are changing as an individual. You're probably sleeping differently, eating differently, exercising differently, dealing with stress differently. So your physiology will change anyway, aside from the fact that you're now on hormone replacement therapy. So the importance of follow-up, and which is always a combination of quantitative measures with the blood tests and qualitative measures with how you're doing subjectively, are so important. And yeah, you do get to the point where it just needs that annual check-in. But even then, there's still guys that will see us more frequently than that with bloods and checking in on things, which is I think a sensible thing to do.
Yeah, it's interesting, isn't it? Because again, we've done this thousands of times. So in those first few weeks, men often describe like a honeymoon period, and we get their results back and they're super physiological. So it's like, oh, they're too high. But I feel great, doctor. I says, yeah, but you won't feel great in a few weeks. And it's tried and tested. In the past, when we first started the clinic, it was like, well, we don't know what normal really is, do we? We've got a reference range. So we've sometimes let these guys have sort of a slightly elevated testosterone compared to the reference range. And they've always come back and said, oh, I need to go down, doc. And we're not talking high numbers. We're talking about a free testosterone of 1.
Yeah.
And it's like, I feel great. So yeah, you feel great because you've got high testosterone, high dopamine, high estradiol, high serotonin. But it's about contrast, isn't it? And we think about, yin yang, and we think about the contrast of testosterone with cortisol. It's about that feeling of normal, and when you're not feeling normal, anything different can be either positive or negative, but you need to have that level of objectivity that they can't have as an individual, but we can have that, having seen it thousands of times before.
Yeah, and it's just quality care as well. So if we change anything, we need a measure afterwards, after an appropriate time. So usually 4 to 6 weeks to get bloods done to see, is the change we've made appropriate and suitable, and that's always again a measure of quantitative numbers with the blood test, but also feedback on how you're actually doing as an individual with that.
It's always in your best interest.
Exactly.
Otherwise, we won't do it. I mean, that's the why are you changing my numbers? Well, because I need to. It's like, listen, trust the process.
How a lot of feedback, I'd imagine. One of the questions I would ask would be, well, how quickly will I feel better? What's the answer? Because
it's exactly. It's another one that's really, really difficult because everyone's individual, everyone's different. I'd say largely it's always going to depend on what are you doing alongside TRT. TRT doesn't do anything on its own. I had this conversation with a patient today. If you're doing all the right things pre-TRT, a lot of the time you can think of it as a bit of an uphill struggle. So you'll get some benefits from doing those things, but your physiology's not working for you. So it's squeezing, little wins out of things. TRT just levels the playing field. So what you put in is what you get out. So that's the key. That's the key thing. Okay, generally as a whole, I would say a majority of patients, not all, but a majority of patients inside that first 3 months are usually feeling better than they did pre-TRT. I'd say that's the majority easily.
Vast majority, unless you've got some crazy estrogen.
Yeah.
And then we have to dial that down.
Yeah.
100%.
In some of the answers you just gave there, I think it's clear to see, why we think we're better than other clinics. But, how do we portray that to a patient in regards to, look, this is what we do, and we do it this way because we want to stand out from everybody else, and we think this is the right way to do it.
It's challenging, really, because the reality is other companies are bombarding social media with adverts about testosterone replacement therapy. It's very frustrating. I think what you have to do is present a level of realism, and I do that through my videos on my Noddy channel. Just me sitting talking to my iPhone about testosterone. The education that we put out, that Sean's doing on the new channel that this will be released on, the education on the website. We need to be fully transparent about what we do, why we do it. You're going to get realistic expectations, and it's going to be delivered in a no-nonsense way, because that's what you need to hear. A no-nonsense, factual account of something that you're subjectively feeling.
I think what also separates the clinic from others is that there's a nice balance between, there's a really structured protocol and schedule in terms of how things are done, but within that is a very individualized care. So it's
who are they going to be talking to?
Yeah, the two of us. Yeah, so it's
a case manager, a patient advocate.
Yeah,
they're going to get medical advice from either of us. We both sing from the same hymn sheet. They're going to get the right level of support from our clinical admin team, who they will all know from the videos. And there's that level of realism because it's real.
And I know you do the same thing, but if there's often multiple routes to the same end goal with the patient, and we're always going to tell you what we think is in their best interest and what's the the advisable route. But there are other routes to doing things, and not everything that necessarily I think this is the best way to do it is necessarily the best way for that patient. That involves discussion.
Exactly. I mean, we have regular discussions about patients, about what do you think, why do you think that.
But there's a best way on paper, isn't it? But then there's a best way for that individual, which is not necessarily the same thing.
Yeah, listen, 100%, because on paper, testosterone and HCG daily should be the best protocol for everybody. But we know that some people don't get on with HCG. We know some people don't get on with sub-Q injections. Some people need IM injections to get a bit of a testosterone and dopamine spike. Again, tried and tested. and will always act in your best interest.
If there's one thing you wish all new patients knew before they came and saw you, what would it be?
I think for me would be that they are in safe hands. I think it's probably the most difficult one, because they felt so rubbish and desperate beforehand. There's so much anxiety around that appointment and just entering into that treatment. So I think just having it's easier said than done, but a reassurance that they're in safe hands. Just go with what we're saying. It's always going to be a joint discussion between the doctor you're speaking to and yourself, but just a reassurance and trust that it's you in the right place and we're doing the right thing.
Yeah, listen, 100%. It goes back to what we say all the time. It's trust the process. It's been done thousands of times before. Again, ad nauseum, we will always act in your best interests. It might not be what you want to hear, but it's going to be what you need to hear. If you put the effort in, you'll do what?
Do well.
Oh,
shit. Someone get the t-shirt. He's forgotten already.
That's the second time he's done that.
Shall I just go? I'll get a nice list out. Oh, Sean.
How long have I got to?
Anyway.
That's my job done.